I was just going to say, what would you suggest to someone considering getting their ovaries frozen or their eggs frozen that's going through cancer treatment at the same time? That's a lot to take in.
It is, but I think that right now, I mean, it's hard at that moment because you're thinking about treatment, and I think that in oncology right now, we're starting to do a little bit better at talking about infertility. I think it was one of those things like if you're a boy, you got referred right away, sperm banking, easy collection, no thought process. Where with women, it's not as easy. I think the challenge comes that like you're facing all these costs when it comes to regular chemo treatment and like the medicines, etc. That when you're also coupling in, well, who's going to pay for the storage fees? Things aren't covered by insurance always. And so I think that's where people struggle with, you know, and so it's harder to like convince people that like, you know, there will be a future, you know, hopefully after the cancer treatment. And I mean, obviously this is living proof that, you know, sometimes you just have to take a gamble, but it is, every circumstance is very different. So I think it's challenging. I wish there was, and I know you've been working on like trying to get insurance coverage, you know, for everything.
We had, Amy came to the White House to lobby for insurance companies to pay for this. And it isn't really very expensive. I mean, they pay, you know, maybe hundreds of thousands of dollars for your cancer treatment. This isn't expensive. On the other hand, if a young girl, and I say girl, 19 years old, is facing cancer and might have a $6,000 hospital bill that is uncovered, she has to think about it because she doesn't have any money. So I've said in our infertility meetings that it's criminal, absolutely criminal, that, and I use that word, that insurance companies don't pay for us to freeze the ovary tissue on cancer patients if you're particularly covered with good insurance. And it's also criminal that our professional society, ASRM, still calls this experimental, which gives the insurance companies an excuse for not paying. This is obviously not experimental anymore. It might have been experimental 21 years ago, but it isn't now.
Right, correct. I mean, there's been a lot of success, and, you know, that has happened since then, you know. So, yes, but that is definitely the challenge.